of Honduras know hardship all too well. It's part of life there. Last fall, Hurricane Mitch devastated the poor Central American country, but it's not a nation without hope. Last week, we went along with a team of local doctors and nurses who gave their time and their training to make a difference for the Hondurans, one face, one smile at a time. The children in Honduras are like most kids. They make their own fun. They laugh and play with their friends. Most are unaware that they live in one of the poorest countries in the hemisphere, a country devastated last October by Hurricane Mitch. The hurricane killed some 5,500 people. It leveled homes, crops, bridges, and roads, making it difficult, if not impossible, for the people to get medical attention.
60% of the population has access to medical care. 40% don't have access to medical care. It's just a matter of not having the proper logistics.
The country's medical needs extend far beyond injuries caused by Mitch, needs the country cannot meet. But help comes from thousands of miles away. A medical team from Chicago and Northwest Indiana called Healing the Children pays its own way and brings its own supplies, determined to make a difference. In 1 week, the doctors will examine hundreds of children and perform surgeries on the most serious cases. Plastic surgeons, an anesthesiologist, a pediatrician, nurses, even a high school Spanish teacher serving as an interpreter transport equipment and supplies to the small town of Danlí, a town that should be 2 hours south of Honduras' capital city, Tegucigalpa. But the journey is much longer because repairs to roads and bridges are far from complete. When the 14 Americans finally arrive at the tiny hospital, they're greeted with anticipation and hope. Hundreds of people, many of whom have traveled for days, stand in line for hours, hoping the doctors will be able to help their children.
The better functioning foot you can give a child like this, the better chance he's going to have in life.
You see how his teeth are all coming in at different levels there?
Pediatrician Dr. Clark Kramer makes sure the children who need surgery are healthy enough to undergo the procedure. Doctors Nick Retson and Vic Lewis are plastic and reconstructive surgeons. They schedule some patients right away for surgery.
How does the schedule look?
But for others,
She has a normal hand and there's nothing surgical that we can do for her. Sorry.
conditions are primitive. Supplies, medicines, even a sterile hospital environment the U.S. takes for granted aren't even available here. Yet the team makes the best with what they've got.
Now I feel better. We're ready to work.
At the end of the first day, more than 100 sick, injured, and deformed children have been seen, and the surgery schedule is filling up.
There's so many cleft lips because it's a genetic problem. The highest rate of cleft lip and cleft palate is in the Native Americans. They have a rate roughly of about 1 in 600 live births. Unfortunately, they don't have the people with specialized training down here.
Many patients have also come in with serious burns caused by open trash fires or the firewood, which is used for much of their cooking.
The people here live day to day, and since the hurricane, conditions seem almost unlivable. They scrape by on whatever they can. An entire family could work a whole day and earn just a few dollars.
Some of them make like $50 a year, and that's what they survive on. I don't know exactly how they do it.
10-month-old Josue Baptista is the first baby the doctors will operate on.
In the United States, they would operate on this, probably it would be completely fixed within a year.
Those who haven't had the surgery at a young age, like 20-year-old Carlos, have had to live their lives looking like this and unable to speak. Carlos walked 20 hours to get here, unaware that he had pneumonia.
If we can get that lip fixed and he looks a lot more normal, that usually is the biggest thing that we can do for him. We're going to try and find the muscle on both sides so we can put that back together.
We can normalize their lives in a relatively safe procedure in a relatively short period of time.
The doctors put the final stitches in Josue's new mouth, and then it's time for recovery.
The first reaction that almost everybody has to a cleft is that you can't get it together. The second reaction everybody has to a cleft is how wonderful the kid looks.
And Josue's mother and father couldn't agree more. As Carlos looks at his new face for the first time, he's overcome with emotion.
If there's anything you can do to help touch their lives in some way that will make it a little better, you know, it's rewarding.
We're not filling out papers. We're not doing insurance forms. All we're doing, this is what we all went into medicine for, was to be able to help people and take care of people. This is great. This is paradise.
And it was indeed a busy week for the Healing the Children team. It saw 839 patients in the clinic and performed nearly 50 surgeries. And when the doctors and nurses returned, many said they were already looking forward to next year. It's quite a moving experience.